years ago, the scientific community was abuzz about the Human Genome Project, which promised to change medicine as we know it. Among the innovations that followed was a new wave of prenatal screening tests, like Maternity 21, which claims to detect chromosomal abnormalities like Down syndrome with almost 100% accuracy. But our partners at the New England Center for Investigative Reporting found the manufacturers don't make it clear to doctors or patients that these tests only indicate the potential of a defect and that false positives are more common than most people think. They also found that these false alarms are leading women to abort healthy fetuses. That almost happened to Stacy Chapman, who was told 3 months into her pregnancy that her son would be born with Edwards syndrome.
The mortality rate is high, and even if most of them are stillborn, and then if they do survive, it's not more than a few days, even hours, and they can't breathe. They suffer to get breath, and I just was like hysterical.
She made up her mind to abort, but her doctor called back, urging her to take another test to confirm the diagnosis. That came back negative. And 6 months later, she gave birth to a healthy baby boy. My next guest is pushing for more oversight over prenatal tests. Dr. Benjamin Hammer is a specialist at Boston Maternal Fetal Medicine and is a fellow of the American College of Obstetrics and Gynecology. Welcome to Greater Boston, Benjamin. Welcome to have you.
Thank you for having me.
A lot of these tests are things a lot of us have never heard of because they've come on the scene relatively recently. But when you talk about oversight, I mean, these people are selling you a product. Are you trying to say that they should have, it's an advertising issue? I mean, what kind of a safety trigger would you put in effect?
One of the things that we found with these tests were that they were not using sufficient negative controls. So when you do a test, you need to make sure that you have a specimen that you can analyze, that you have data, so that your result is actually the result of the patient. So what we wanted to do is to try to get out there to get these negative controls into place.
Are these tests really necessary? I mean, let's just cut to the quick here. I mean, Edwards syndrome, 1 in what, 10 million? I mean, it's negligible. I mean, are they necessary?
The tests are necessary. So
they are.
We advocate for screening tests. So these tests tell women whether they're at high risk or low risk for things like Down syndrome or Edwards syndrome, which is also called trisomy 18, and other genetic syndromes along those lines. And the tests are very, very powerful. They have a high degree of accuracy. But they are still just screening tests. And I think that what we were running into is that these companies were trying to sort of make them into a little bit more into a diagnostic test, which they are not.
One of the most disturbing articles I read from the NECIR was about how some of these tests, they did a control group, and they actually had 3 non-pregnant women submit samples, and it came back, oh, normal fetus in development. It's like, what? They couldn't even tell whether it was from somebody who was pregnant or not.
So we ended up sending 2 non-pregnant women's blood samples to these companies to test. And out of the 5 companies, 3 of the companies returned results that said normal female or no evidence of a chromosome abnormality. And 2 of the companies reported results that said that there was an insufficient fetal sample to be able to be analyzed.
Well, that's good.
Exactly.
That is at least accurate.
Exactly, because those 2 companies were using those negative controls. So when you have a pregnancy test, there's the one little line that says that that the test is able to be looked at, that the test was valid, and then there's the other line that says whether or not you're pregnant or not. These tests that 3 of those companies are using are like a pregnancy test without that first line.
So do these tests have to go through the same set of approvals as like a drug through the FDA or not?
I'm not sure what the testing regulations
are. So probably no.
I'm not an expert in that.
But I mean, do the drugs, I mean, we know that drug companies peddle. I mean, we've seen it. We see the data around doctors' offices. So they're out to sell you a product. Do you also tell your colleagues in the obstetrics community to say, you got to be aware of all this stuff and make sure that, your patients know that this is one this is one test, but it's not definitive.
There's a lot of PR, so there's a lot of advertising that these companies are doing to get the information out there to both patients and to providers, and it's really up to the providers to learn enough about these tests so that they can order them and counsel their patients appropriately.
All right, Dr. Benjamin Hammer, thanks so much for being with us.
Thank you for having me.